Dr. Giordano. I am a holistic psychiatrist with Free Range Psychiatry. We're a practice that specializing in a holistic approach to helping people who want to taper their medications. And I see people all over the country. I'm licensed in multiple states. I've been a part of Free Range for the last 3 years, and kind of to be expressed out in the world for people to know and understand about mental health care in the U.S. or in the West is, I think, some decades ago we thought that we would solve a lot of our mental health problems through the use of medication. There's interesting history about the advent and development of the practice and institution of psychiatry in the U.S. And I think it was also corresponding to a time in our evolution as humans as kind of coming to that point of better living through chemicals. And while I very much appreciate, what humans are trying to do in terms of helping people, it's a very unidimensional approach to human beings who are multifaceted, multidimensional creatures. If that was going to work, basically 1 in 6 of us are on psychiatric medications presently here in the United States. If that intervention was going to have fixed things or helped us out as human beings, then what we would expect to see is rates of suicide, incidents of mental illness, disability rates. We would expect all of those things to then, decrease and or be at all-time lows. And that's genuinely and obviously not the case. So mental health issues are rampant in our country and communities. And so I think having practiced in psychiatry, conventionally, and then also now from a different vantage point, from a holistic approach, I would say, in meeting so many people who are out there trying to figure this out and navigate mental health care in the U.S., it's I hope it's a time that we're reaching, especially with the advent of the internet and social media, for us to collect a lot of the anecdotal evidence that is available via peer-based online support communities that have brought a lot of voices together, people who are struggling with similar things, including some of the difficulties and detriments of psychiatric medication. In the last 3 years of my life, I've had the good fortune to be able to work with people and explore this whole topic and help to understand about what people are going through in a context where we have time and space to actually listen to them and hear them and observe and spend the time. And it's been, for me, very illuminating from someone who practiced very traditionally and conventionally early on in my life to someone who now practices with a very different approach. And it's not that I don't use medications. I still do. They still have relevance and importance at times. But I think not as a one-stop shop approach. If that's the only thing we're going to have in our arsenal when patients come to us when they're struggling with anxiety, depression, grief, focusing, attention, concentration, that's a very limited. It's one tool, right? It's not enough, in my opinion. And then the whole other end of it is kind of in the holistic approach, people start getting better. People start being able to consider tapering their medications down or tapering off their medications. Maybe they went on medications, there was an episode of depression or anxiety, things have changed, they've grown, they've come out of an acute, challenge or difficulty, and realize that maybe the need for medication is not so much there anymore. And then understanding is starting to see what happens when a person tries to come off a psychiatric medication that they're taking on a daily basis. And my observation of that would be that any psychiatric medication that you are taking on a daily basis, I don't care which class it's in, which one it is, the body becomes physiologically dependent on it. Typically, that's only historically been acknowledged for traditionally like the benzodiazepines, like Xanax, Ativan, Klonopin, all those, Valium. But what I would say, I've seen it maybe not hundreds of times yet, but it feels like almost hundreds of times of people being physiologically dependent on SSRIs, being physiologically dependent on a medication in a class of antipsychotic. And so it's for which people need to be then appropriately informed and then prepared about how to taper. So that's where I've specialized and spent a lot of time in the last several years of my life and career. I'm sorry, I just went on and on for a bunch of time. So I don't know whatever you guys want to hear, I don't want to be just rambling. So if you have any other ways or ideas for questions that you want to ask or any other topics, or I could talk about this topic probably for hours. So you'll have to probably just kind of rein me in or direct me about what you want to hear.
Are we okay?
Yes. Hello.
Hi. So I'm now on Abilify 50 milligrams. I'm taking the shot actually at 662 milligrams. Every month, every 28 days, I'm getting the shot. My doctor says the next dose is 10 milligrams, 441, right? And I want to know, my doctor doesn't trust me with pills. So as of now, I'm still with this doctor. He's not a holistic psychiatrist at all. So I wonder to hear what do you say? Is it safe to go down from 662 to 441? The next shot.
Yeah. So here's the thing. I think in the context of kind of this conversation, I can't give.
I'm sorry. I can't hear you very clearly. I'm sorry.
Oh, yeah. Can you hear me? Can you
now
hear me
it's better.
Okay. Yeah. So I think I appreciate what you're wondering and questioning, and in this context, in these things, I can't give specific medical advice or things like that. What I will say, here's what I'll say, maybe just to give you some of my observations, is the manufacturers' dosings of medications are typically quite far. A medication might be dosed in 300, 150, 100. There's big jumps between medication doses, is what I would say. It's different for injectables, and I think you might have been referring to an injectable. It's different. Injectables are designed differently. They've got a longer acting, the way they're released in your body and all that. That's a different story. But what I would say is that in general, the doses that are available through the manufacturers make it difficult to make jumps between doses that are more easy to tolerate, I would say. I use compounding a lot, in other words, and I know this is probably off. It's different for injectables, right? Because they're designed differently in terms of how they break down in your body and their half-life over time. But things that are taken orally, the jumps are pretty far between the doses. So I compound with most every patient that I see, because we want to make jumps between the doses that are less, that are smaller than what would be possible if they're using manufacturers' doses. I know that probably doesn't help your particular situation, but that is something that is, in my opinion, an issue.
So it's not okay to jump from 652 to 441, right?
I'm not saying that because you were talking about injectable, correct?
What?
Were you talking about the injectable form?
Right. I'm talking about injection.
Yeah, so the injectable form is different because the way that breaks down in your body, that makes it, and it gets complicated, that makes it a different situation than if you're taking something orally. But those are big jumps, you know. I mean,
it's not such a big jump.
No, I say those are big jumps. I'm not sure what the percentage is, but those are big.
I can't hear you clearly.
Yeah. I can't say that it's. I won't say that it's unsafe, but I would say. Yeah, I mean, making big jumps in medication doses can be challenging and difficult, and you want to really, really think it out about how you're doing it, and really be informed, as in working with your psychiatrist, so that you can understand. Okay, what's this medication's half-life? How are we timing the dose based on that? What would I expect the blood level of this medication to be? You know, between doses, or how is that going to impact how we time doses and all of that.
So why would the psychiatrist make it such a big jump like that?
It's not their choosing. They don't decide. The manufacturer does. So all we have as psychiatrists we have the doses that the manufacturers make available. We can't whip up or mix up different doses of the medications themselves. We can only use what the manufacturer creates or makes. And
so let's say she were. So do you want to talk a little bit about what you guys do at free range? And let's say she sees you. Would it be so you wouldn't be able to make it less? You're saying it would have to be the same thing.
Well, for an injectable, you can't. They're dispensed in. I've never compounded an injectable, but if she was on an oral medication, and if she was someone who was a candidate to taper, and if she was ready and that was appropriate to be able to do a taper, we would look at making a reduction of more, I mean, I'm going to give ballpark figures. These aren't exact, but we would make a reduction more along the lines of 10%. Or even maybe 5%, depending on the person, depending on the medication. There's a lot of factors that go into picking the percentage, but maybe rather than a lot of times the manufacturer's doses might make it such that the jumps between them might even be 50%. Like maybe they make a 300 milligram or 150 milligram and then 0. Doesn't give you a lot of room for choosing the percentage of reduction.
Wouldn't that mean that she would have sorry, I didn't mean to cut you off. Wouldn't that mean that she would have an episode? Let's say, meaning would that mean that she would possibly have an episode because of the big jump?
Well, again, injectables are different. I think the way they're more forgiving. Anything that has a longer half-life. So you get an injectable, say like once a month, right? So it has an extraordinarily long half-life. When it comes to withdrawal symptoms, that's a lot. They're typically less. If you have something, the shorter the half-life, the more you're likely to have withdrawal symptoms with a medication versus a longer half-life medication, because your blood level of that medication stays more steady over time in general. So you're better able to tolerate reductions because it's a slow taper off rather than an abrupt decrease or drop in the blood level of the medication.
Okay, so it's not necessarily unsafe then to do that, because
it's an injectable. It's long acting, so it's going to gradually, slowly decrease out of your system, and it's not the same as using something with an extremely, like a 4-hour half-life.
Okay, and do you want to talk about what else do you in your practice you talk about tapering, do you also do supplements and things like that?
Yeah. We work with people with using supplements. Really, we create a holistic, comprehensive plan for people, which involves looking at a bunch of different things about health and well-being. So we'll look at their medical health and do lab testing if needed and merited. We would talk about diet, nutrition, supplements, exercise, stress reduction, therapy, holistic practices, their life situation, relationships, spirituality if it's relevant, all the different factors that can go into human well-being. Because, as humans, again, kind of saying, like, we're multifaceted, multidimensional creatures. We're not, it's a very reductionistic thing, in my opinion, to just kind of distill us down to some biochemistry. Like, okay, we'll just tweak your biochemistry, give you some chemicals, make you feel better. If it were that simple, man, that would be amazing, but we're not such simple creatures. We're complex. And so those different complexities need to be addressed. Because maybe, like, for instance, there's so many times I hear stories of there was something going on in a person's life that merited or caused them to be feeling and then behaving in a particular way. But no one ever listened to that. No one ever kind of heard that, took that into context, said, okay, well, let's let you go through that with some other kinds of support. Let's let you go through that with some therapy and let's help you take care of yourself with some, good diet and some exercise and some relaxation practices. And so a lot of times people will get medicated for something in the first place that could have been addressed using some other holistic things, and then they've started to get involved with medications, and then they're being a good patient, so then they're on them for years, and they just keep being prescribed, and then, a decade later, they're on the medicine and not sure why, and then there's ramifications to that because the medications have side effects.
Yes, thank you. Yes, exactly. I'll tell you, just so you know, I have a brother who was put on medication when he was younger. He was a teenager, so that's what he was going through, and that didn't, he didn't do it perfectly, obviously, and he got medicated because I guess he wasn't so good in school, whatever the reason that they had. And so he's currently on Risperdal. He's been on Risperdal for about 15 years. And then they put him on a what's it called, injectable, I guess what you call it. He's on that now. He never wanted to take the pills, and so because of that, they were like, oh, so let's do an injectable instead. That's how he got on it, because he didn't want to ever do pills. So, yeah. Anyway, I'm sure there's other stories on here. Would anyone else like to ask? Let me try and mute. Somebody just came on. Let me see if I can mute them. Would anybody like to ask any questions to Dr. Jennifer? Is it Giordano or Giordano? How does that go?
Giordano. Yeah.
Giordano?
Yeah.
Is it Italian or?
It is. Yep, it's Italian. Like the
okay. Right on. Okay, we have a few more people that came on. Awesome. So for the people that came on, we have some, if you have any questions, we have Dr. Jennifer Giordano. She's a holistic psychiatrist, and she can answer any questions that you have. So I'm going to open the floor. So who would like to start? Oh, someone just messaged me something. Hold on a second. Okay, here's a question. So, okay, yeah, if you want to ask anonymously, you can also message me as well. Okay, so here's a question. It says, what damage do psych meds for mental health conditions, what damage do psych meds do for mental health conditions and different diagnoses?
Yeah, so different medications have different side effects associated with them. So, for example, I'll just pick one off the top of my head, the SSRI, so the antidepressant medications, things like Prozac, Zoloft, Lexapro, Celexa, Those all, the ones that people struggle with the most and dislike the most are the numbness, the emotional numbness, feeling cut off from one's emotions, sexual side effects, difficulty with libido, having orgasm, feeling stimulation, weight gain, lack of motivation at a certain point. Some people start to feel like just kind of blah, not interested in life, lack of passion, lack of feeling connected to one's own feeling. I would say that one in particular is like ubiquitous across all the different, or common across all the different classes of the psychomeds, is that numbness feeling disconnected from oneself. Everybody hates that. And I think that's the number one reason why people dislike the medications, is that feeling of cut off. They somehow deeply feel cut off from themselves, and or numbed or slowed down or just distant from reality. That's probably the number one. Other things, antipsychotics, akathisia, that is a terrible side effect. That feeling of inner restlessness. Of course, other motor and muscular symptoms, weight gain, metabolic syndrome. I mean, there's a lot. I could keep going. The benzodiazepines. I mean, those are extraordinarily difficult in the long run for a lot of people, due to their negative side effects. So, yeah, there's a lot.
Okay, I'm here. Okay, thank you. Chaim, did you have any other follow-up questions?
Hi, can I ask you a question again?
Sure, go ahead.
So I'm suffering from restlessness, from the Abilify, and my doctor gave me Congentin. He said if I want, I can take it. I wonder if there's any other natural thing that I can take instead of Congentin to help me with the restlessness.
You're having akathisia or restlessness with the Risperdal?
Yes.
Yeah. Yeah, I can't. I don't think I can make specific recommendations. I'm not sure, because I can't give medical advice. But there are some things that can help with akathisia. But essentially, supplements that help with relaxation, things like magnesium.
Yeah.
And there's some other ones, but it would also depend on, and this would be why we would look at things together, in an appointment when I can see the medical history and see all the other stuff that's going on, to be able to use some supplements to help with akathisia. But that is one of the most challenging, one of the most uncomfortable and challenging side effects of the medications that there are.
Okay, anybody else have any questions?
Hi. Hello?
Hello?
Hi, yes, go ahead.
Yeah, thank you so much. I feel so privileged to be on. It's my first time. I don't know, how long you've been doing it. I got the number from a friend of mine. So I feel so lucky to be on the call now. I'm on the phone. I don't have access to internet in my house, and I'm wondering if there's a way to contact the doctor in person. I'm currently seeing someone in the holistic, doing holistic things, but he's a man, and I'm not so comfortable going to him. He is in person, but I'm wondering if there's a way to see the doctor in person. I
am practicing only virtually right now. We went virtual during the pandemic, or things went virtual during the pandemic. I think 95% of mental health care was being delivered online or virtually. And then got licensed in multiple states. So then now I'm just entirely virtual right now to be able to do that. But I'm sorry about that. It would be nice if we had an in-person place to be able to go, but we don't presently. Not that that couldn't change, definitely. But if you wanted to reach out to, if you don't have internet, that's a little bit of a challenge. Because I was going to say you could still, reach out to us in some way to keep in touch or stay on our email list if you want, in case that ever changed in the future. Certainly you could feel free to be in touch with us that way, info@freerange.org, if you want to contact us to stay in touch, get on our email list. One thing is libraries. Libraries have free internet and usually a meeting room that you can be in if you ever could utilize that. But we don't currently have an in-person option.
Okay, so for the person who just spoke, I just want to mention that there is somebody in Queens that can also help. He's in person, Dr. Michael Grevich. So just so you know, but we can also talk more about that later. Did you have any other questions for her?
Yeah, so also, like, I'm wondering if I feel like, for me personally, I was on medication for about 2 years. It was like 4 years ago, and I'm currently off all of the medications, and I'm taking supplements and trying to keep a healthy diet. I'm also wondering if the medication made me more sensitive, because I'm now gluten-free and dairy-free. I'm trying to eat more like certain food that I'm like sensitive, and trying to eat organic, like organic eggs and other stuff. I'm wondering like if I should maybe go back to eating gluten and dairy, or like for now, if I'm already like for sure 2 years I'm already on a strict gluten-free and dairy-free diet. If it's good the way it is.
So what I'll say that I see with that is, and great job too. Great job on the work that you've done. That's fantastic. Really great. Being gluten-free and dairy-free can be very helpful. Those are common inflammatory type of foods. And what I would say is what I see a lot of times for whatever reason, and I'm sure it's multifactorial, but when people are going through particularly a medication taper, is their whole body's sensitivity just seems to be heightened to kind of everything. Even things you wouldn't think it would be sensitive to. And so supporting yourself with a low inflammation kind of diet is just helpful and supportive in general. And it depends on how long you've been off the medication, how things are going for you now, what do things look like, what was your experience while you were consuming those foods, what's your experience now not consuming that, what's your current health. A multitude of factors would go into being able to give you a more specific recommendation on that, but I would say very helpful. I commonly see people reduce those things or eliminate those things and feel better or do better. It's supportive to your gut lining. The health of your gut is so vital, important to your mental health. I think we really disconnect those two things. Mental health and your gut. Traditionally, that it's not like you go to your psychiatrist and they would be asking you about your gut or your bowel movements or things like that. But what I would say is your gut is where you absorb all the building blocks that you need to make the neurotransmitters, to regulate the neurotransmitters, to make hormones. You have to be absorbing properly. So things like your diet, supplements, staying hydrated, hugely, hugely important. I spend a good amount of time with people, not enough time, but I would love to spend more, but I spend a good amount of time talking to people and supporting people in their dietary choices. So eliminating the inflammatory stuff, gluten, dairy, sugar, highly processed food, and then upping the content of, my favorite, if you can up the content of two things. One is the dark green veggies, dark leafy greens, spinach, kale, chard, even broccoli. You want to get, the green veggies, and then berries. If you were looking just for two simple things to implement, I even tell people, don't worry about necessarily if it's seeming difficult for you to restrict something right off the bat. First, just try adding those things. Just try adding high nutrient food to your diet, dark greens and some berries, on a daily basis, and just start to see how you feel. Eating hydrated food, like uncooked food, raw food, helps to, those are foods that have a high amount of water in them, a great way to also help yourself be hydrated. So not only the nutrients and the vitamins and the minerals that come out of it, but also the hydrating effect and the effect that has on your gut to help make sure that you are pooping every day. You need to poop every day, at least once a day. Really important to your mental health. Again, not something we traditionally acknowledge or necessarily recognize or advertise, but how your bowel functions, how your gut functions is very important to that piece. And psychiatric medications can really kind of do a number on that because they affect the different, they affect serotonin, and there's serotonin receptors in your gut. And I think almost every psychiatric medication affects your gut, just by hearing people and talking to them and hearing their experiences of what they go through in response to medications and or reducing them can still cause upset and difficulty with the gut.
Wow, thank you so much. Did you have, okay, so there is another question that came in. I'm going to ask it real quick. We're going until 9 o'clock, right? Just see. Yes, 8:38. Okay. All right, so the question was what is an alternative to Adderall and Ritalin? And then the follow-up question is, how would you treat trauma? And then we have anxiety, depression, ADHD. So those are a few questions, but I think maybe what is an alternative to Adderall, Ritalin? And then I don't know if the diet, I mean, I know you sort of answered it, but I'm saying I don't know if there's more or, yeah.
Yeah. Well, I'll just start with the first one, and then you'll have to remind me after I answer that about what the subsequent ones are. What's an alternative to Ritalin or Adderall? There isn't one. I mean, and I'll dive deeper into that. But if you're looking for a literal alternative, stimulants are extraordinarily powerful medications. In terms of what they do to your system and your energy, those are extraordinarily impactful medications. And one of the things they do and how they operate is, yes, they can make a person focus and concentrate because they're so activating. They are so stimulating. Anybody who takes a stimulant will focus and concentrate better. It doesn't matter who you are, whether you have diagnosed ADHD or not. Anybody who takes a stimulant will be able to focus better because that's what they do. In terms of, and so what I'll get to is what I think probably the question is, or maybe what are other things I can do to help my focus and concentration outside of using a stimulant. And I would say, again, that would be, it would be a complex process for us to kind of go into and dig into the nature of the difficulty and challenge with the focus and concentration. This is where you want to use the multifactorial approach. First and foremost, finding out, okay, when did this start? When did the issues with focus and concentration start? What was the context around them? Were stimulants ever used before? This is the whole going through the thorough history to help us understand, more about the nature of the difficulty and challenges with attention and concentration. Has it been lifelong? Is it adult onset? But there are things you can do absolutely similarly, nutritionally. Let's look at your diet. If you are eating things that are high in sugar or high in high glycemic foods, you are continuously getting blood sugar spikes and dips, spike dips, spike dips, spike dips. So that is going to, I don't think we don't take into context or factor in how important blood sugar is also to our mental health, for attention and concentration, for things like anxiety or even depression. So diet is also another big thing that, you could delve into and look into, and you want to make sure in getting out the things, again, that can be inflammatory and or causing difficulties or a lot of fluctuations in blood sugar levels. Supplements. Definitely some things that can be utilized there. Again, that would be person-specific to kind of get into what kind of supplements can be needed. But there are some powerful things you can do with nutrients. Again, I don't find a lot of absolute holy grails, like, oh, this is the one thing, it's a silver bullet. But if you do the diet, you do the supplements, what are you doing for exercise? What are you doing to take care of yourself? What are you doing for relaxation? What's your life like? What's your life situation? What's your job? What's your family situation? What are you going through that, with that, relationships? A lot of times people will be having a very difficult life situation or something going on in their life, and then wondering why it's hard or they're struggling to focus and concentrate. And then if we start to dig into some of the origins of that, it can be very illuminating. Dr. Gabor Mate, I love his commentary and his work about some of the things about our difficulties with attention and concentration being related to or connected to trauma. Basically having our inability to focus and concentrate being related to, or being almost a conditioned thing, or a response that we developed in the face of certain traumas or early life situations. So delving into that, gotta look into that stuff. So this is why it gets complex. Again, this is why if you're going to work on your mental health with somebody, you want them to listen to you and take time with you. And it's a long haul. There are no quick fixes. There's no free lunches. There's no magic bullets. I wish there were. I would love it if there were. It would make my life really easy. But there aren't. The work is work. And anybody who's done anything for their mental health, who's tried to help themselves, knows that it is work, and it's digging into the multifactorial stuff and then piecing it out. And if you can do that, if you're willing to do it, and then if you have the support to do it, you can make a huge difference in your life. I have seen amazing things. People do amazing things in helping themselves with this kind of approach. I'm sorry I'm forgetting your name, the person who took gluten and dairy out of your diet for the last 2 years. That has not been easy. That was not a walk in the park. Maybe after a certain point, you kind of got used to it. It became, your habit, your just way of maneuvering in the world and making your food choices. But that was not easy. Any change in your life isn't easy. And then also digging into these other aspects of ourselves that require introspection, looking at our history, reflecting on the nature of our personality and our person. That's not always, and it's often uncomfortable. But in the end, when you have the diligence and you kind of do that work and stick with it, you can definitely see results. A long answer to a short question.
Very nice. Thank you. Did that answer your question? Oh, this is great. Never mind. It was online. Thank you so much. That was, okay, so we have one more question. It's from somebody who wants to know an alternative for bipolar disorder. So I don't know if you want to speak a little bit about that. Alternative to medication for bipolar disorder.
Oof, man, you came ready with your questions today. Yeah, and I don't mean to repeat myself, but I will, because maybe it's also too just kind of the essence of the message this is such an individualistic this is such an individualized question. What a person's journey is going to be if they've been given a diagnosis of bipolar disorder is going to be so unique to each person who goes through that. I have seen so many different forms of that. I have seen people who had mania triggered by marijuana or Adderall or SSRIs, and that can potentially or might be different than somebody who just has, who just has a spontaneous episode, but it's complex. And again,
hold on, I'm going to mute her. Don't worry. Okay. Okay, there we go.
Yeah.
Go ahead.
Yeah. So again, this is where we would sit down together and look at your whole story and start to unpeel and get down to, okay, what happens? I want to hear about your first episode. Like, it's amazing to me what I've heard about some people whose first episode was secondary to an exposure to an SSRI or Adderall or, a stimulant. And then they were then given the diagnosis of bipolar disorder and then just treated as if they just had bipolar disorder out of nowhere. And that was, what they were being treated for over years and years or even decades. When you actually go back and kind of look at things or question things and kind of do some of the detective work to put the pieces back together of what was the origin of this, and then, okay, what has happened or what has transpired after that, and what do we want to do about that now? And that's where, again, you got to dig in with a multidimensional, multifactorial approach. I can't make a blanket statement of, okay, this is what you do for bipolar disorder as an alternative to meds. It's going to be completely individualized for each individual person. But similar things, again, right, going back to, okay, let's look at the medicines you've been on. What are you on now? How are you doing? How many episodes have there been? Looking through all of that stuff, hospitalizations, all that stuff. What has your life's journey been up until this point? And then, okay, what do we want to do now from here? And looking at all of the stuff, diet, supplements, the medicines, it's doing all that stuff. And also, you've got to do the, particularly, I would say, with a diagnosis of bipolar disorder, got to do the person work, the therapy work, the introspective work, I think with any struggle with mental illness, but, digging into, okay, what was some of the trauma from early on in life or later in life? What was going on in those developmental and formula formative years. Is that a word? Am I making it word? But formative years, what was going on. And that also, I've seen people do some incredible work when it comes to that. And if you do it, I've seen people stay stable, be stable. I've seen some pretty amazing things when people do that.
Awesome. Thank you so much. Good answer. Thank you. Appreciate it. Okay, we have one more question, and then I think we're going to end off. Anybody else?
Can I just ask, you said the therapy for bipolar. Do you know what kind of therapy you recommend?
This is a great question. And what I would say is there's not a blanket therapy that I recommend. Again, I meet the person, we talk, we hear about where they're at, what they've done before, where they are at presently, and where we want to help support them in going. So for example, say things right now are really, really stable. They've been stable for a long time. There's a bunch of, good, holistic, kind of good supportive, behaviors going on, and they're fine, pretty steady. But maybe something happened in their past that they, hadn't addressed or wanted to address further. And then it would depend on, okay, so what resonates with them. See, the form of therapy has to resonate with where the person is at. Again, it's why it has to be a meeting. I feel like it's a meeting of the minds. We come together and talk about it. Okay, where are you at? What makes sense for the level of, intervention from the therapy standpoint that makes sense now? It's not always time to do the trauma work. Sometimes it is. If that person's, like I said, stable, things are flying steady, they're at the point where, okay, they want to dig in. Sometimes it is not. Sometimes it's not even close. It's more of a supportive approach and kind of, and that way. Sometimes it's a time for maybe some CBT and mindfulness, putting those together. And it really depends on the individual of where they're at, what they want, and what they need in the moment. But great question, because I think it's a mistake to think it's so prescriptive, right? That you could just say, okay, do this therapy. It's the right one for you. It's the right one for everybody in this situation. Not the case. It's the right therapy is different for everybody and at different times too. You'll have people, okay, they started off doing some kind of CBT, and then it's okay, took that as far as I could. Okay, maybe want to do a little EMDR. They're feeling a little more stable. And do some EMDR or somatic experiencing. Or it's a spectrum, and I would say this kind of thing should be given thought and sensitivity to where that individual is and what's right for them at that time.
Okay, do you have any other questions? Did she answer your question? Okay, so we're going to go to one last question, and then I think we'll wrap up because it's getting close to the hour. So the one last question is, and I have this question too. This is a question I also interested to know, which is, what is the damage based off of taking medication versus how long? Let's say you took it for a few months, right? Or let's say you're taking it for a long time. Is there a difference, I guess, long term? The damage, and what exactly would that be? Somebody had a question about what damage stimulants had, so if you could maybe speak a little bit about that.
Mm-hmm. Yeah, that's a good question. And my observation is, and in working with people in particular kind of in this realm, is certainly the longer you've been on a medication, the more propensity there is for, negative side effects and or for your body to be quite dependent on it. Your body has habituated to having this medication in your body. It's so used to having it there. What I would say for people who want to try to taper medications is that the longer you've been on the medication, it's going to correspond to a longer taper. It's just, it's just, that's the way it seems to really happen and or appear. Difficulty with the stimulants. I've seen stimulants cause psychosis. I've seen stimulants. It's dependent too, and I don't want a blanket statement like, okay, this is what will happen, because it doesn't happen for everybody. That's the other interesting thing. Not everybody who goes on a stimulant becomes psychotic, but some do. And why here's the thing too, is I think that, first of all, we have to listen to the individual, person. And again, we so much want to tailor the approach and the interventions to that individual the best we can. Two, I still think we're in the dark ages of understanding how different medications act in different bodies. We don't know. We're doing a lot of just mass prescribing of psych meds, not considering that some people really metabolize these things differently than others. And it's some people can just jump right off their SSRI and get off and go back on and then give it up, and it's fine. Some people are devastated in trying to come off their SSRI, and it might take 2 years to just taper off a medicine that they took for, kind of a transient episode of mild depression or some anxiety. But how we don't know that, and I hope in the future of medicine, and that we'll start to hone in and zone in on how and why do we metabolize medications differently. I hope also we'll include that more in the informed consent piece of it. Because if you can give the consent of, this may happen, we don't know. You may get the side effect, you may not. And it would be great if we could say though too, here's the percentage of people who have this particular side effect. Now you decide, you choose, okay, this percentage of people have whatever, have a particular side effect for a particular medication, and then letting people make that informed choice and informed decision.
Yeah, 100%. 100% I agree. I don't think they do informed consent enough, and they say that this drug is just going to cure your mental illness, and they don't actually tell you the side effects sometimes. Anyway, we have one more question, and then we'll let you go. Also, if you could just quickly say real quick though how to get a hold of you if people do want to contact you. If you would just.
Yeah, so easiest way to get in touch with us is please go check out our website, freerange.org. Best way to ask us more questions, or if you want to be in touch, is send us an email at info@freerange.org. And then our phone number is 786-4572. And happy to hear from everybody. We also have we've got a live chat, or you can ask questions through our website as well.
Okay, and what was the phone number one more time? 786, and what was the
next one? Put it in the chat. I can put it in there.
Okay, great.
4572.
So the number is 786-453-4572 for anybody. And then we have one last thing to say, and then we're going to sign off. We're at a cafe, so they're kind of kicking us out. Okay, go ahead.
Okay, first of all, regarding beta blocker, the medication that I'm being tapered off on, I've been on it for very long. Okay, the question is the beta blocker. What are the long-term dangers of beta blocker, and how often has it been used? As off-label to use for anxiety? In my case, it's not used for anxiety. It's used for a cardiac condition, but I'm going through a slow tapering process. But what's the long-term dangers biggest long-term dangers of beta blocker, Inderal especially, propranolol?
I'm sorry, it was a little bit muffled, but I caught that you're tapering off propranolol.
Yes.
A beta blocker.
Under integrative cardiologist.
You're seeing an integrative cardiologist?
Yeah, so I'm going through a slow tapering. It's taking me by now like almost about at least 2 years to get completely off the medication. But the question is like what's the biggest long-term dangers of being on a beta blocker like Inderal?
Well, I would say from a mental health perspective, I'd say from the other physiological perspective, like the cardiac perspective, take the cardiologist, input and his or her input on that aspect of it. From my standpoint, from a mental health perspective, it's just its contribution to depression.
Oh, so I can understand the past 2 years seeing like I can feel the whole process of the tapering. Like the whole it's like I feel like it takes it's like because if I do feel a little bit the withdrawals I do feel a little bit of withdrawal, but not so. But it's like but I do feel like the whole big psychological change I'm going through as I'm tapering.
Yeah. Yes. And so I'm thrilled to hear that you're tapering. That's fantastic. Sure. Yeah. What I'll say is that it's always better to taper a medication. I mean, I'll give a blanket statement in general. There are times when you got to do a quick taper for the sake of safety, or if there's something else going on. Sometimes a quick taper is just merited. But in most cases, a slow taper of a medication is really helping any psychogenic or psychoactive or psychoaffecting medication. Really, it just goes a lot better in the short term and the long term in terms of allowing your body to adjust. There's something about big, rapid changes in the biochemistry that the brain does not like. I've seen people try to come off medications unsuccessful multiple times. They finally come to us. We do a very, very slow, gentle, mild taper, and they get off. So I would say good job on doing a slow taper. That is super cool. I have not heard of that, to be honest, with an integrative cardiologist doing a slow taper of Inderal or propranolol. I think that's fascinating, and I'm wishing you the best with that.
So beta blocker alters the brain chemistry, like any other psychiatric drugs.
So it can. What they've noticed is that being on a beta blocker can be associated with depression. Do we know the full mechanism of that? I don't know that we know the full mechanism of that. I've not seen the biology of the specifics of why is that. I think there's been theories about it, about why that would potentially be linked to or contribute to depression. But that's what I've seen and read in the research or literature. And again, not for everybody. Some people don't experience that. Some people a lot of people are on beta blockers all over the place and do okay, but some don't, or some have associated depression with it.
Oh, I've been on 60 milligrams of Inderal for at least. I've been on like a total of 60 milligrams of Inderal for like 14 years, and before that, I used to be on 180 milligrams. So I was starting the long-acting Inderal from 25 years ago, from 120 going up to 180 milligrams, and then in the past since 2006, I was down to 60 milligrams a day. The past 2 years, been like every few months, I've been like slowly tapering from 60 milligrams a day down to 60 milligrams every 2 days, then down to every 3 days. Then this year, every 4 days, down to every 5 days, and it's being replaced with hawthorn and motherwort, which are cardiac herbs, but they also have calming effects.
Wow, amazing! Great that you're working with an integrative cardiologist on that. That's amazing.
Was that a very toxic level that I was on?
Was that a very toxic level?
No, I want 80 milligrams of Inderal. That was in the past. Even 60 milligrams a day, long acting. How like?
Well, we're kind of getting out of my wheelhouse. I mean, I typically use propranolol, or it's used in a lot smaller doses for psychiatric utilization. That the integrative cardiologist will know a lot better than me. It's,
okay, sure.
You know, adjunct kind of thing for use, and with other situations or other diagnoses from a psychiatric perspective. But, yeah, but I think it's really cool what you're doing, the integrative stuff.
Thank you. Anyone else have any other questions? I think we'll wrap up, but we really, really, really appreciate that you came on and you spoke with us, and just really happy. You know, we live in New York, which is we're in a religious community over here, so we don't really get to talk to a lot of different people. We have a lot of people here, by the way, who are diagnosed and they take medication. I know it's everywhere, but I notice it's also in like religious communities as well. So we really appreciate you talking to us and giving us some information and informing us about what's going on. Thank you.
Yeah, absolutely. Thanks so much for having me. Yeah, it was great to speak with you all. Great questions, everybody. Thank you.
Okay. Talk to you soon. Talk to you later. Bye-bye.
All right, take care. Yeah, bye-bye.
Okay, bye-bye.